Hello everyone, welcome to Pharmarock Academy YouTube channel. In this video, I would like to discuss 10 previously asked pharma related questions and its explanation. So, without taking much of your time, we can start now. Let's moving on to the first question. The synthesis of glucose from non-carbohydrate source is defined as option A. Glycolysis, option B. Gluconeogenesis, option C. Glycogenolysis, option D. Glycogenesis. The correct answer is gluconeogenesis. We already tell about gluconeogenesis. The non-carbohydrate sources, the examples are lactic acid, glycerol and amino acids. It mainly occurs in liver and kidney. Let's see the other options. The glycolysis. It's a metabolic pathway. In this, the glucose is broken down into energy. It produces two molecules of pyruvate, ATP, NADH and water. It mainly takes place in cytoplasm in the cell. The pathway does not require oxygen. Then moving on to the glycogenolysis. It's a biochemical pathway. In this, the glycogen breaks down into glucose. It mainly takes place in liver when the blood glucose levels are low. Next one is glycogenesis. It is a formation of glycogen. It is a primary carbohydrate that's stored in liver and muscle cells of animals from glucose. Formation of glycogen from glucose when the blood levels are high. The second question is, which of the following drug is a parasympatholytic agent? Option A. Demicarium. Option B. Atropine. Option C. Pilocarpine. Option D. Carbachol. The correct answer is option B. Atropine. Autonomic nervous system is classified into cholinergic and anticholinergic. Cholinergic drugs is also called cholinomimetics or parasympathomimetic. These are the drugs which produce action similar to that of acetylcholine either by directly interacting with cholinergic receptors is called cholinergic agonist or by increasing the availability of acetylcholine at these site, that is anticholinestrases. The cholinergic agonists are classified into cholinesterase and alkaloids. In cholinesters, the examples are acetylcholine, methacholine, carbachol, bethanychol. Under the alkaloids, three drugs are there: muscarine, pilocarpine and ericholine. The carbachol and pilocarpine are already given in our option. Anticholinesterases. These are the agents which inhibit cholinesterase, protect acetylcholine from hydrolysis, produce cholinergic effects in vivo and potentiate acetylcholine both in vivo and in vitro. Some anticholinesterases have additional direct action on cholinergic receptors. These anticholinesterases are then classified into reversible and irreversible. In reversible, there are two categories are there: carbamates and acridine. The drugs under carbamates are physostigmine, neostigmine, pyridostigmine, edrophonium, rivastigmine, donepezil, galendamine, demicarium. Demicarium is already given in our option. So think that you can understand that. Then the reversible classification, there are organophosphate and carbamates. Under the organophosphate, there are difluorous, ecothiophyte, parathion, malathion, diazinon, tabun, serin, soman. Then carbamates, carbaryl, propoxer. Some insecticide, these are used as insecticide nerve gases for chemical warfare. Anticholinergic drugs. These are also called muscarinic receptor antagonist, atropinic, parasympatholytic agents. In our question, mention the parasympatholytic agents. These are the drugs, those which blocks the actions of acetylcholine on autonomic effectors and in the CNS exerted through muscarinic receptor. The nicotinic antagonist also block certain actions of acetylcholine. They are generally referred to as ganglionic blockers and neuromuscular blockers. Then comes under the classification of anticholinergic drugs. We can classify it into first one, natural alkaloids. In this, the drugs includes are atropine, hyoscine or scopolamine. The second classification is semi-synthetic derivative. It include homatropine, atropine methonitrate, then hyosyl butyl bromide, ipratropium bromide, and tiotropium bromide. Then the third classification is synthetic compounds. In synthetic compounds, the three categories are midriatrics. In midriatrics, the drugs include cyclopentolate, tropicamide. The second one is in synthetic compounds, anti-secretory, antispasmodic. In anti-secretory, antispasmodic, there are quaternary compounds. Examples are propanthelene, oxyphenonium, clidinium, pipenzolate, methyl bromide, isopropamide, glycopyrrolate. Tertiary amines include dicyclomine, valenthamate, and pyrenzapine. Then synthetic compounds, the third one include basicoselective. The drugs includes are oxybutynine, flavoxate, tolterodine. Then the fourth one is anti-Parkinsonian drugs. The drugs are trihexyphenidyl or benzhexol, procyclidine, piperidine. The third one is the common side effect reported with sulfonylureas. Option A, hypoglycemia. Option B, hyperglycemia. Option C, hypothyroidism. Option D, hyperthyroidism. The right answer is option A, hypoglycemia. Sulfonylureas comes under the category of oral hypoglycemic drugs. Oral hypoglycemic drugs lower the blood glucose levels. So, there is a risk of hypoglycemia to occur. Then, the next question is principal adverse effects of ampicillin. Option A, constipation. Option B, diarrhea. Option C, vomiting. Option D, GIT irritation. The correct answer is diarrhea. Diarrhea, vomiting and GIT irritation are the main adverse effects of most of the antibiotics, in which diarrhea is the most important side effect. Most of the opioid drugs and NSAIDs and all other drugs cause constipation. Fifth question is, which of the following is a major precursor of steroid hormone? Option A, sphingosine. Option B, bile acid. Option C, triglyceride. Option D, cholesterol. The right answer is D, cholesterol. There are five main classes of steroid hormones: progestogens, glucocorticoids, mineralocorticoids, androgens, and estrogens. Cholesterol is the precursor for all of these steroid hormones. Progestogens are produced in corpus luteum. The example of this hormone is progesterone. Androgens is produced in testes. The example include hormone testosterone. Estrogens are produced in ovaries. Example is estradiol. Glucocorticoids and mineralocorticoids are produced in adrenal cortex. The hormone included in glucocorticoid is cortisol, and the hormone included in mineralocorticoid is aldosterone. The next question is, depletion of dopamine causes a clinical condition is called option A, mania, option B, schizophrenia, option C, Parkinsonism, option D, depression. The right answer is C, Parkinsonism. Parkinsonism is a group of neurological disorder that cause movement problems such as tremors, slow movement and stiffness. It is caused by the loss of nerve cells in the part of the brain called substantia nigra, which is responsible for producing a chemical called dopamine. Let's see the other options. Mania. Mania is a bipolar disorder. The term mania describes a state of mind characterized by high energy, excitement, and euphoria over a sustained period of time. It is caused by high levels of stress, lack of sleep, using recreational drug or alcohol. Then schizophrenia. Schizophrenia is a mental disorder characterized by disruption in thought process, perceptions, promotional responsiveness, and social interactions. The cause of schizophrenia is unknown. Then depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. The seventh question is, loss of appetite is known as option A, anuria, option B, anorexia, option C, alopecia, option D, none of this. The right answer is anorexia. Anorexia is an eating disorder characterized by an abnormally low body weight, an intense fear of gaining weight, and a distorted perception of weight. The first option, anuria, means the failure of kidney to produce urine. Then alopecia is characterized by hair loss. Grey baby syndrome is reported with option A, tetracycline, option B, chloramphenicol, option C, doxycycline, option D, chlortetracycline. The right answer is option B, chloramphenicol. The main side effects of chloramphenicol include grey baby syndrome, reversible bone marrow suppression, irreversible aplastic anemia. Let's check the side effects of tetracycline. Side effects are kidney failure, except doxycycline. Doxycycline never causes kidney failure. anti-anabolic effect, photosensitivity, maximum with democycline. Diabetes insipidus is seen maximum with doxycycline. Liver toxicity, that is hepatic necrosis, can occur. Dentition and bone effect include it causes discoloration of teeth and bones. So it is contraindicated in pregnancy and children. Then vestibular dysfunction is seen maximum with minocycline. Doxycycline causes stomach upset and irritation in food pipe. It also irritates the skin and causes sunburn. Nausea, vomiting and diarrhea are most common side effects of doxycycline. It reduces the effectiveness of contraception in females. It also causes yellowish or grayish discoloration of teeth among children. Some serious side effects include intracranial hypertension and inflammatory bowel syndrome. Next question is, carbimazole is an option A, anti-thyroid drug, option B, anti-epileptic drug, option C, coagulant, option D, anticoagulant. The right answer is anti-thyroid drug. Let's see the classification of anti-thyroid drug. First one is inhibit hormone synthesis. The drugs are propylthiouracil, methimazole, carbimazole. The second one, inhibit hormone release, iodide, lithium. Third one is inhibit iodine trapping, that is ionic inhibitors. Drugs included are thiocyanates, perchlorates and nitrates. Then the fourth one is destroyed thyroid tissue by using radioactive iodine. Then the fifth one, inhibit conversion of T4, that is thyroxine, to T3, triiodothyronine. The drugs include beta blockers, corticosteroids and propylthiouracil also. The last and 10th question is, a potassium sparing diuretic that acts by inhibition of sodium potassium ATPase activity is option A, mannitol, option B, amyloride, option C, furosemide, option D, bumetanide. The right answer is option B, amyloride. Moving on to the classification of diuretics. These are classified into, first one, high efficacy diuretics is also called loop diuretics. That is, it inhibit Na plus K plus 2 Cl minus co-transport. The drugs included are furosemide, bumetanide, toracimide. These three are sulfamoyl derivatives. Then one more drugs are there, ethacrynic acid. It is phenoxyacetic acid derivative. Phenoxyacetic acid derivatives. The third classification is weak or adjunctive diuretics. In this, three categories are there. First one is carbonic anhydrase inhibitors. The second one is potassium sparing diuretics. Then the third one is osmotic diuretics. In carbonic anhydrase inhibitors, it includes three drugs, that is acetazolamide, dichlorphenamide, ethoxyzolamide. Potassium sparing diuretics are either aldosterone antagonist or directly inhibit sodium channels in distal tubule and collecting duct cells to indirectly conserve potassium. Spironolactone is an example of aldosterone antagonist. Then inhibitors of renal epithelial sodium channel, the drugs included are triametrine and amyloride. Then the drugs included in the osmotic diuretics are mannitol, isosorbide and glycerol. Thank you guys for watching the video. Hope you understood all the question and explanation. If you like this video, please make it thumbs up, share and subscribe. Thank you.